9,099,136 Ghana cedis. That is the balance in the account of the National COVID-19 Trust Fund as of 30th June 2022. Now, trustees of the fund earlier today have been accounting for donations made towards the fight against the infectious coronavirus. According to them, as of June 2022, the fund had received more than 62 million Ghana cedis and had disbursed more than 80% to individuals and organizations directly and indirectly.
And so, as at 30th June 2022, and that was the height of things, we had actually collected, or we had received 62.329, 62,329,941 cedis, 98 pesos. Never forget the pesos, they add up. And particularly at the heat of matters, we had also received a whole range of in-kind donations. So as at 30th June 2022, the amount that we have spent on various things, the total amount we have spent, including even administrative costs, is 53,230,805 cedis and 37 pesos. And then we really go through details as to what activities these were spent on. Between April and December, we were able to distribute about 10.25 million cedi worth of PPEs and other materials. When we say PPEs, it's not just this, but it's the gloves and the face shields and so on and so forth. And so we were able to do this across the country. 8 testing centers, 9, all the regional and municipal district hospitals, etc., and 126 CHIPS compounds. We were able to do all that. We gave 8 million cedis to the reopening of educational institutions coordinating committee to purchase PPEs and sanitizing items and gels and things like that to enable the reopening of the tertiary institutions. Out of the blue, we received a passionate appeal letter from a family who were distressed because they didn't have money to pay for the bill of their deceased relative who had died from the COVID-19. And after investigation, we don't just jump on sentiment. We looked into it, and we paid the hospital bill.
Excerpts of the press conference there, but let's get much more into detail in terms of the funding and expenditure of the National COVID-19 Trust Fund. Isaac Ovieje is with our research desk, joins us with details of how the 62 million Ghana cedis has been disbursed. I also need to acknowledge Dr. Ifa, who's the Deputy Country Director for SEND Ghana. Thank you, sir, for your time. But first, let's get the details, a breakdown from Isaac. Isaac, give us updates on more of the fundings and where, of course, we had the expenditure going to in terms of the National COVID-19 Trust Fund.
Blessed. So we know that the donation came in 2 forms. So we have the kinds, and then also we have the cash and then checks, or cash or checks. But we will focus more on cash or checks because we can quantify that easily. And so we know, just like she said, a total of 62.3 million Ghana cedis were received as donation, cash or checks. and then a total of 53.2 million has also been expended, and meaning we are leaving a balance of 9.099 million cedis. And so it simply means that about 85.4% of the monies we've collected as COVID-19 in the COVID-19 trust fund has been expended.
Did they give a period? And I'm sorry for cutting through, but did they give a period as of when and how these funds were expended?
So this report actually covered, as of June 30th, 2022. So right from 2020 when the fund was established to June 30th, 2022. And so as I was saying, it means we've expended about 85.4% of what we received into the COVID-19 trust fund, leaving about just 14.5% in the fund. And so I'll go into the details shortly. If you look at the years that the disbursements were made, was right from 2020 to 2022. So if you count the number of line items in the 2020 side, you can count about 13 of them, making it the biggest component. And then also 2021 having about 9 components. And then the last one, the least being 2022 itself, having about 4 components. So let me run you through some of the key expenditure items. So we know the fund had to give an amount of 10.3 million for procurement of PPEs, and they also gave 6.8 million for the COVID-19 private sector fund.
And I guess this is all contained in the document that you're referring to now.
Exactly. So this was supposed to help with the construction of 100-bed, the National Infectious Disease Center in Accra. And remember that project was commissioned on the 24th July 2020, blessed. And then the NCCE also had a total of 2.5 million to help with logistics. And then Pantan Hospital were given 106,000 as support. Noguchi also received, this all in 2020, Noguchi received 5.57 million Ghana cedis. And the National Reopening of Educational Institutes Coordination Committee also received 8 million cedis.
So we'll be not to cut you, but we'll be going into some more details as we ready that document for our viewers to also follow through. But let me bring in Dr. Ifa at this point. Earlier this year, Send Ghana issued a statement raising some concerns in your report about the lack of transparency in COVID-19 expenditure. Gradually, it appears that government is tilting towards your feedback and opening up some more on the expenditure. You agree?
Yes, thank you very much.
It appears that we've lost connection to Dr. Ifat there. But Kofi, if you're still with us, let's bring some more details in terms of issues relating to some more amounts that were received. It appears that the
management trust,
the
board of trustees,
Dr. Ifat is back, so let's listen to him then.
Paying heed to our call. Sorry, so I was making the point that this is exactly what Send Ghana and other civil society have been calling for. And so just want to first of all commend the board of trustees for the fund for at least paying heed to the call of Send Ghana and other civil society organizations. It's a show of transparency and accountability in the management of the fund. So that would be my very first comment about it.
And we are learning that about 80% of the amount...
If I have the time...
We're learning that about 80% of the fund already has been expended. Are you surprised about this? Okay.
No, I wouldn't say... Sorry, I'm interrupted, so I may be breaking a little, but that's fine. So I wouldn't say that... I'm surprised about it because if you look at the report, fortunately, I have the chance to peruse it a little. If you look at it, they've given an extensive breakdown of the expenditures. I mean, where each of the donations came from and where it went to. And so I'm not surprised about that, considering that we are looking at almost 2 years from March 2020 when the trust fund was established I believe it was around March 27 or so, up till now. And so in a space of 2 years, I'm not surprised, roping in as much as 63 million cities and then spending close to 53. So I'm not surprised about that. The only thing, though, is that considering the fact that it's dwindling, and the board chair actually indicated that now funds are not coming in as much. The fact is that considering that there were no accountability from this all time up to now, I mean, this is about 2 years that they are actually giving detailed accounts. And you would expect that in as much as Ghanaians are altruistic and they willingly donated to the fund, the fact is that if I'm donating and you are not really showing me what the fund is being used for, then obviously you don't expect people to donate as much.
Beyond the press conferences,
so my expectation is that I was saying that my expectation is that once now the trustees had accounted for and has clearly shown that they are just left with around roughly 10 million, I think 9.9 million or so in the PT, maybe that will encourage as many individuals, groups, and corporate bodies to donate costs to the trust fund.
I was just about asking that beyond the issue of the press conferences, are you urging that more and more stakeholder engagements will happen, for instance, with Parliament and some other governing bodies on how the COVID funds were expended?
I believe that is the right thing to do. And indeed, not only with Parliament and not only with government institutions, but the fact is that it's corporate organizations and individuals who are contributing to it. Maybe they are doing it, but we are not aware of. But I would advise that as much as possible, the same corporate organization that they went to get the money, they should also at least account directly to them. But of course, it's important that we have Parliament playing the oversight role. And then remember when this whole issue came up, we mentioned it to Ministry of Finance to at least show us some details about the trust fund, but they indicated that it's not within their purview to do it. So I would suggest to them, to the trust fund, that as much as possible, they could also liaise with Ministry of Finance, because the fact that they are supposed, Ministry of Finance are supposed to hold some of these funds for us. So that is another suggestion. Let's go to Parliament, account to them. Some would say that we've done this public account already. Coming to the press to account to them. But it's also important that we sit to look at the details. That's one thing I realized. Because in the press conference, they couldn't have given us as much details as they probably would have. But when you have the chance to meet certain critical oversight groupings like Parliament and whatnot, and even engaging civil society directly, I believe that there will be the opportunity to ask certain questions and to see how that could actually be addressed.
So you're expecting the leadership of the trustees to appear before the Parliamentary Select Committee. As been directed by the Speaker already, we understand that a probe is likely to be carried out into this.
Yes, that is exactly what we are calling for. One, we are commending them for the initiative they've taken, but they could go a step further by engaging Parliament. And the fact is that when you do that, you instill confidence in the populace, confidence in as many people who would want to contribute more. But I'm surprised that Ghanaians really, are altruistic. Look at it within the space of if it was even less than 2 years. Now we got 63 million just to support the worthy cause. So people are willing, but they need to really get a sense that yes, there's some accountability as to what they are contributing their monies and in-kind donations to. So I'll call obviously for that.
I thought that would have been the last one, but finally, does this led to the conversation about the private initiative, which the former Chief Justice has pointed to, the fact that there was a private initiative who was then working as the agent on behalf of the National Trust. That's the private sector COVID-19 fund. She says that that's a different initiative from what was commissioned by the president, except that they were working as agents on behalf of the National Trust Fund. Would you expect some probing to that aspect as well?
Well, in fact, personally, that was my understanding, from the beginning, because I remember that was purely the private guys who started this. And that is what led to the burden of the nice edifice at the East Municipal Hospital. That was my understanding. But I think after that also, then when they started this initiative, then the government established the COVID-19 Trust Fund. And so for me, it's good that they work hand in hand because it's just for the same purpose. That is the little that I can say about it. But as to how the level of engagement between the trust fund and then the private sector initiated fund, that I cannot speak directly to it, but I don't know how they did. But I believe that it's also a good case. Well, if you look into the report, you realize that they support, the trust fund did support with some money in respect of what the private sector guys did. And so I said that, well, such collaboration could go on. And possibly we can learn from this in the health sector to look at other sectors as well.
Dr. Eva, I'm grateful for your time here on The Pulse. Let me bring you back, Isaac. What more do we need to know about this?
Right, Blazer, so per our checks, we realized that right from 2020 to 2022, the amount of the number of expenditure line items have been reducing. So if you pick 2020, for instance, there were about 13 line items that the trust fund had to disburse monies to, and then it dwindled down to 9 in 2021, and then now in 2022 we have just 4 line items. But just like I said, out of the amount that has been received into the coffers of the trust fund, about 85% have already been utilized. And if you go into the details, you actually realize that a chunk of the money was used to purchase PPEs. And just like, it was said at the press conference, PPEs just doesn't necessarily mean just nose masks and other things. So there were so many things that went into the procurement of PPEs. They also had to support a lot in terms of reopening of school. But I also want us to juxtapose this with how much government itself said they expended in total, what the finance ministry actually said. So if you look at support to households, for instance, in 2021, that cost the nation about 1.55 billion Ghana cedis, and health response cost us about 1 billion. Health infrastructure cost us about 600 million. And security operations cost about 875 million. And we also have COVID-19 supplementary releases accumulating to 104 million Ghana cedis. And so, just like the finance minister said, these funds were outside, the domain of the ministry itself. It was in the coffers of the trust fund. So it was only the trust fund who could actually give this kind of detailed reports that they are given today.
So reconciling the data, do we seem to get some parity in terms of the figures that we're receiving from the finance ministry and from the trust fund?
Well, if you do a comparative analysis, you could realize that what the trust fund itself has spent on certain line items is actually just a small component of what we spent in total as the finance ministry outlined. The figures for the finance ministry are in billions, and then we have these figures actually in millions. So there's a vast difference between what the finance ministry itself spent, about 12 billion Ghana cedis in total, and then the trust fund just spending about 53 million. So there's a huge difference. And I'm not sure it will even be up to, about 5%.
Interesting. Let me save you that trouble. I'm sure that we'll hear from the Health Committee and the Finance Committee in Parliament in the coming days as they probe further into this issue of the COVID expenditure. Isaac Ovieje with our research desk. Thank you.